Hello, I'm Dr. Michael Vazquez. I'm an orthopedic surgeon, sports medicine specialist here at Milford Regional Physician Group. Just here to talk to you for a few minutes about the most common causes of shoulder pain and problems that I see in my office. Number one on that list would be rotator cuff problems. And rotator cuff problems can run from a tear in the rotator cuff to simply inflammation around the rotator cuff. Both these problems can cause pain, and these are common reasons why patients see me in my office. The treatment for rotator cuff problems do depend on the actual extent of the inflammation or the tearing. However, in general, we think about bringing down the inflammation with medications such as nonsteroidal anti-inflammatories, but also in my practice, I will give patients cortisone injections to help with inflammation. And then there are times where patients require surgery to repair the rotator cuff. Typically, at least once a week, unfortunately, somebody needs that surgery to have their rotator cuff repaired. Another common cause of shoulder pain that I see in my office is arthritis. Arthritis can affect any joint in your body. In the shoulder, there are two joints, the main ball and socket joint, as well as the smaller AC joint that's on the top of the shoulder. Arthritis is when the cartilage wears down and inflammation occurs, causing the pain. In my practice, when I see patients with arthritis in their shoulder, our main objective is to get them feeling better and to improve their function. So typically this includes anti-inflammatory medications, physical therapy, and unfortunately, if patients continue to have severe pain, surgical options such as arthroscopic surgery or shoulder replacements can be very helpful at relieving the pain associated with arthritis in the shoulder. Another very common cause of shoulder pain that I see in my office is something called frozen shoulder. And it essentially is inflammation throughout the whole shoulder joint that freezes the shoulder, where patients feel their motion is very limited and quite painful. This is a problem that can happen after an injury, or even most often, patients really don't know why it started. So in my office, I typically do treat this with a steroid injection if the patient would like, because that really does a great job at bringing down the inflammation and getting some pain relief. Also physical therapy to help regain that motion that they've lost because of the problem. Most patients with frozen shoulder do not need surgery and will eventually improve over time in treatment. The last common cause that I typically will see in my office is pain that's actually referred from their necks, from the C-spine, from the cervical spine. So what that means are the nerves that come from your neck go down into your shoulder and down your arm. And there are patients that I will see in my office who have shoulder pain. However, the problem isn't actually with the shoulder joint itself and can be coming from pinched nerves from their cervical spine. So whenever I examine patients with shoulder pain, I typically start with their neck range of motion to try to figure out if this is actually a pinched nerve as opposed to a primary shoulder problem. As an orthopedic sports medicine specialist, I do focus in on surgical treatment for many problems, but also non-surgical approaches as well. And in our new office here on Prospect Street, we have many other practitioners that as well specialize in both surgical and non-surgical options for not just shoulder pain, but essentially every other joint pain that may occur. So this would be a place where you could come to be evaluated and appropriately referred to the proper physician that could further treat you.